The number one reason you're not fixing your low back and butt pain patients who have had pain for more than 6 months and they've seen at least 3 other doctors or therapists without relief is because you're neglecting the anterior abdomen and pelvis. There are about 10 to 15 major nerves and structures inside of the abdomen, outside of the psoas, that when they're entrapped and stuck will cause protective tension of the psoas especially, but maybe iliacus. And when those muscles are protectively tight, no amount of stretching or massage is going to relax them. So learning how to own and master this area is very important if you want to specialize in fixing chronic low back pain and butt pain. So what we're going to do today is we're going to go through the various nerves, and given the fact that you're not in this room with me and not at an Adhesion Release Methods training with me, I'm going to do the best I can to guide you in actually feeling these nerves. When you want to feel these nerves, bow them, diagnose them, treat them, and see if they're stuck, the best way to do that is by you feeling the anatomy first. So James is actually one of our apprentices. He's been training with me for about 6 or 7 months, and most of the time what we're doing when we train for 2 hours each week is we're just feeling nerves. Feeling the course of the sciatic nerve from the butt all the way down to the feet and all of its branches. And we found that just by doing that, you are able to better diagnose a nerve entrapment by bowing the nerve and then treat the nerve entrapment, because he spent so much time in the foundational principle of feeling what nerves feel like wherever they live and then getting used to mastering that. So if you really want to treat chronic pain, you need to own treating nerve entrapments. To own treating nerve entrapments, you need to practice feeling the nerves in all the different spots where it lives. So that's what we're going to do for the abdomen. It's an extremely important area if you want to fix chronic low back pain and butt pain. When somebody has chronic low back pain, the first area that I usually look to fix low back pain is the abdomen. That's how important it is. So I'm going to do the best I can to show you the map, and hopefully you find this very helpful. So I'm just going to go down the list. The first thing to do is to feel the psoas. The psoas is the phlegm and yawn piece of meat that goes underneath the inguinal ligament and inserts on the lesser trochanter underneath the inguinal ligament with the iliacus here. It is a cylindrical piece of meat. If you've ever eaten phlegm and yawn, you're looking for a cylinder. So what I'm doing right now, here's the lateral psoas, here's the medial psoas. I'm pinching the psoas in between my fingers. And then I can do that all the way up until it inserts at the diaphragm. This is all the psoas. This is all the psoas right here. It's very important to identify that piece of meat because this is going to be a major landmark for most of the nerves that we're treating. After you do the psoas, you're going to find the iliacus. If this is ASIS, putting my fingers here and just grabbing this tissue against my fingers this way is iliacus. Psoas is right here on my fingertip. Iliacus is right here, and it circles around here. Right here is the anterior portion of the iliac crest as it wraps around. So that means that anything above this point, this is all quadratus lumborum on the anterior side. So I have QL underneath these fingers, iliacus under these fingers. All of this is psoas. And obviously, all of this is underneath the abdominal wall, because sometimes if people have superficial tension here, I'm just pressing down with a 1/4 inch of depth, a 1/2 inch of depth. And then if you feel a little bit of tension, that the abdominal wall is pulled tight, and then you go nice and slow and you wiggle your fingers back and forth, you can feel the subcostal nerve in this area or the intercostal nerves up here. And they run like this, the intercostal nerves, or the subcostal nerve, or the anterior hypogastric nerve, and they'll be inside the abdominal wall, not deep at all. So if you ever feel a little piece of linguine or pasta that's running like that, it's an intercostal nerve, subcostal, anterior hypogastric. So we have those nerves, psoas, QL, iliacus, that are deep to that on the anterior side of the spine here. And then we go through the nerves. Typically, umbilicus is around L3 level. So that means that if I come just lateral to the psoas here, you can see me piling up this muscle tissue right here. So this is the psoas. The femoral trunk is going to come out right here and go this way. So if I go at the lateral posterior edge of the psoas and I sink down and in, there's a nerve underneath going horizontal. This is the femoral trunk before it comes the femoral nerve running this way in the crevice just lateral and posterior to the psoas. This is the femoral trunk. Here's the L2 femoral trunk right here. I'm on the lateral posterior portion of the psoas. L2, L3, L4. These femoral trunks can get stuck behind the psoas or at the anterior intertransverse posterior to it. And then the femoral nerve runs like this. It's underneath my fingertips right now. So right here, femoral nerve, it's stuck right there because it's actually a little popped up. Here it's deeper and I can move the femoral nerve around. And then it comes all the way down to the inguinal ligament, which is right here. It runs like my index finger like this, and the femoral nerve runs under that inguinal ligament. And the inguinal ligament can get stuck to the femoral nerve. So I can bow the inguinal ligament off of the femoral nerve to see if it's stuck. He's got a little bit of entrapment right there. Now the lateral femoral cutaneous nerve comes out at the femoral trunks. Also, we call them the femoral trunks. They also become the lateral femoral cutaneous nerve at L2 and L3. So if I'm feeling the femoral nerve, which is going like this, I'm feeling it right there, and I go lateral to that, any nerve that runs this way towards just underneath the ASIS, so it runs like this, and it runs like this, here, and goes this way, is the lateral femoral cutaneous nerve. It has to be. It's the only thing in that way, in that location. So right here, I'm lateral to the femoral nerve, and I'm feeling a nerve going down this way towards my middle finger. So it goes from here and here to right here. That's the lateral femoral cutaneous nerve. It's the only thing there. So I recommend you get in here and you sink in. So how far in am I sinking? It's probably about 3 inches. If I watch where my finger is, my middle finger is right here. I'm sinking in 1 inch. That's about 2 inches. I'm 2.5 inches in, and here's the lateral femoral cutaneous nerve. James, can you tell that I'm on the nerve?
Yep, right on it.
And what's cool is when you train this all the time, because James, Casey, and I do this 2 hours a week, they know what nerves feel like because we just practice this all the time. So you know what, you just learn that this is what nerves feel like when you push on them, and this is what nerves don't feel like. So that's the lateral femoral cutaneous nerve. It can get stuck right here next to the femoral nerve. It can get stuck at L2 next to the femoral nerve, and it can get stuck all the way in between. So that's LFCN. So now we also have the nerve. They become the femoral trunks lateral to the psoas, L2, L3, L4. But the nerves also come out on the medial side of the psoas. So I can get on the midline here, and I could take my fingers medial to the psoas, and I could lift the entire psoas up and see if they will come off of the nerve roots. So right in here, right above his umbilicus, the psoas does not want to lift. So if I get in deep around this, and I sink my fingers in around it, I'm on the medial posterior portion of the psoas. He has, the nerves are going this way, there, and then also the lumbar sympathetic ganglia goes straight up and down in that crevice. So what I'm actually feeling for him is that his lumbar ganglia is entrapped. We've treated this before on him. And it's stuck to his psoas. So you can feel the lumbar ganglia on the medial posterior portion of the psoas here. And underneath that, the nerve roots come this way. So you'll feel the ganglia going up and down. You'll feel the nerve roots going this way. And then you could also feel the nerve roots deep on the medial portion of the psoas underneath the umbilicus. And you have to sink in a little bit. So I'm sinking in with my middle finger. There's the skin. I'm probably I'm about 3 inches deep in James, who's pretty lean. And here's his nerve root. I'm feeling something go this way against my finger. That's the nerve root. And it's firm. I can't bow it. It's stuck. He needs that treatment. So I can do that at L3, at L4, at L5. Then we have the obturator nerve is underneath the psoas, but down low, if his pelvis is right here, my finger's right next to pyramidalis right here, the obturator nerve swoops in against the iliopectineal arch, and you could feel the nerve going sideways, deep, right posterior to his pelvis. That's his obturator nerve at IP arch. And I'm pushing it down right now. So it's like this, and I'm going like this. Then, superficially, a common spot that I'll treat entrapments, if LFCN's coming like this where my index finger is, anterior hypogastric runs on top in the abdominal wall, like we said before, and this creates a kind of X. So this tissue can get stuck in here, and I just stick my finger and I try to grab this X. I'm grabbing in there, and things can get caught and stuck if people are having LFCN symptoms down the lateral thigh, or anterior hypogastric tension down parallel to the inguinal ligament, about an inch superior to that. So I'm checking that area as well. On top of the psoas, the genitofemoral nerve lives. So if somebody's having testicular symptoms or cutaneous nerve symptoms on the proximal hip over here, medial side, the genitofemoral nerve is very superficial because it's on top of the psoas. It pierces the psoas around L2. And you'll often feel the spot where it peeks out of the psoas and it runs down the top of it. So right here is where the genitofemoral nerve comes out of the psoas. Right there's a little entrapment and it's stuck. And it runs down on top of the psoas for most of it. And it splits into the genital branch and the femoral branch. So that's where the genitofemoral nerve lives. You can get a little bit of the ilioinguinal nerve and iliohypogastric nerve as it comes out of T12L1 areas over here. So right there I'm on it. He's got a lot of other extra tension. I can't really feel much here because you're just going to run into the kidneys right in that area. So that kind of blocks the way. But again, ilioinguinal comes in the inguinal ligament, but the anterior hypogastric is 1 inch superior to that. This is the territory of the abdomen and the front of the pelvis. So if you haven't done this before, I recommend that you just get a checklist of all the nerves, and you have that list, and then you're just gonna look at the anatomy app, and you're gonna start to look for and feel those tissues, feeling for the noodles in the direction that they go, where they live. And given you're not going to have instruction, you're just going to practice and asking yourself if you feel like you're on it, how convinced, getting as close to 100% certainty can you be, knowing where those nerves live and the orientation is, not having that instruction. To the extent that you can do this yourself and learn where those nerves live and what they feel like, and you practice that. Can you practice 2 nerves every single day, and you do this every single day for weeks or months, you will really start to develop an immense ability to feel. And then as you're doing that, you're going to be able to start to feel where a nerve bows and it moves around. You push on it and it wiggles back and forth. Or when you push on it and it's stuck, it's not budging or moving. And that's entrapped. And then eventually you'll get to feeling when it's swollen or irritated, because that feels even different. More different, excuse me. You'll go to push it and it won't necessarily move, but it'll feel swollen and boggy. It'll just have a different texture to it. So this is the anterior abdomen and the pelvis. Please go ahead and practice this. If you have any questions, comments, or thoughts, or anything you think that I can do to make this easier for you, please comment below or DM us at Adhesion Release Methods on Instagram. And I will do the best I can to answer any questions you have, to point you in the right direction if you're struggling or need support. I really want to help more people with our content, figure out how to fix people's chronic butt pain issues, low back pain issues, so on and so forth. So any way I can support you, please let us know. Good luck with this. I love you so much. Have a great rest of your day. Boop!